The benefits of ginger. The benefits of ginger, according to the degree of effectiveness, possibly effective reducing nausea and vomiting, as a comprehensive analysis published in the American Journal of Obstetrics and Gynecology in 2006 pointed to the possibility of the effectiveness of ginger in relieving vomiting and nausea that may occur after surgery, and based on a study published in the Journal of Pediatric Blood and Cancer in 2010, it is possible ginger can reduce the severity of vomiting and nausea that accompanies cancer chemotherapy, along with the treatments prescribed. Reducing vertigo. A small study was published in the journal ORL, which showed that it is possible for ginger to significantly reduce the occurrence of vertigo, as the study was conducted on a group of healthy people after causing vertigo in them by exposing them to one of the tests of the vestibular apparatus called the thermal test system. Despite this, it is possible that ginger is not effective in relieving motion sickness, as some research indicated that consuming ginger 4 hours before travel as a maximum does not reduce motion sickness, but rather can lead to a feeling of improvement as a result. Its use, while one study showed that ginger can affect the reduction of motion sickness, and stomach disorders associated with it. This is one of the benefits of ginger. Reducing some symptoms of osteoarthritis. Ginger can positively affect osteoarthritis, as a study published in Arthritis and Rheumatology in 2001 conducted a group of people with moderate to severe knee pain, and the results showed the potential for effective ginger extract in reducing pain while standing or walking and significantly reducing symptoms, while side effects were limited to feeling a slight discomfort in the abdomen. In addition, a preliminary study published in the journal Natural Product Research in 2016 showed the possibility of the effectiveness of ginger supplements and other kinds of herbs in reducing the of knee pain and when consumed for 30 days. There is insufficient evidence for its effectiveness. Insufficient evidence. Reducing indigestion. Ginger contains a group of chemical compounds that contribute to the process of digestion in general and helps to calm stomach pain, and ginger can also improve indigestion, which is represented by feeling uncomfortable, feeling pain in the upper part of the stomach, and delayed gastric emptying from the main symptoms that lead to indigestion. So a small study published in the European Journal of Gastroenterology and Hepatology in 2008 showed that ginger powder can accelerate gastric emptying by 50% when consumed before a meal with a dose of 1.2 grams. In another study published in the World Journal of Gastroenterology in 2011, it was found that the time spent by the stomach in emptying their contents after eating soup was reduced from 16 minutes to 12 minutes as a result of eating ginger's dyspepsia. This is one of the benefits of ginger. Joint pain relief. Research has shown that eating a specific product containing ginger for 8 weeks reduces joint pain by 37%, but the effect of the product was limited to that, as it did not improve joint function, and did not reduce stiffness. This is one of the benefits of ginger. Headache relief. Fresh or crushed ginger can help relieve migraine symptoms, which ranges from mere discomfort to a feeling of exhaustion, and ginger also reduces inflammations in the blood vessels, in addition to relieving pain caused by the headache, and this may be useful for children who suffer from this type of headache. This is one of the benefits of ginger. Reducing cholesterol levels. A laboratory study published in the Journal of Acupuncture and Meridian Studies in 2016 showed that it is possible for the ginger supplement to reduce the level of cholesterol in the bloodstream, in rats that were given a high-fat diet, and despite this, more studies are needed to confirm these efficiencies for humans. This is one of the benefits of ginger. Reducing ulcerative colitis. Ginger can help improve overall disease activity of ulcerative colitis, but it does not improve quality of life, or repeat defecation, nor has it improved gases or stomach cramps. This is one of the benefits of ginger. Reducing the common cold. Ginger contains some of the compounds that may help reduce colds, and relieve some of its symptoms, such as heat, pain, and cough, and in addition to that it helps to feel warm, and ginger can help the body to sweat, and reduce infection. This is one of the benefits of ginger. Other benefits. Ginger can affect many other conditions, but more studies are needed to confirm its effectiveness, including the following: anorexia, nervous appetite, anorexia, cholera disease, flu, Ginger benefits for diabetes. The relationship of ginger with diabetes is a relatively recent topic in the field of medical studies, but ginger may have some effective anti-diabetes properties, as a study published in the Iranian Journal of Pharmaceutical Research in 2015 showed that people with type 2 diabetes take ginger daily for 12 weeks, reduce fasting blood sugar levels, and their HbA1c levels, but your doctor may need to adjust your diabetes medication doses to prevent incompatibility with ginger, as it can raise your insulin level and lower your blood sugar level. But this does not mean avoiding the consumption of ginger completely, as it can be consumed under the supervision of a doctor, as it is a good alternative to salt, which may lead to high blood pressure when excessively ingested, and it can be added to enhance the flavor of drinks and foods as a kind of healthy spice, or use it fully to flavor tea. In addition to due to the use of its powder in baked goods, the consumption of its manufactured products such as sugary drinks may not bring the desired benefit to the patient as much as it may increase the high sugar. Ginger benefits for allergy. Ginger is one of the natural methods that can be used to relieve the manifestations of seasonal allergies and sinusitis, as a laboratory study published in the Journal of International Immunopharmacology in 2008 showed that ginger can modify the immune response to infections associated with allergic asthma, which may make it one possible way to alleviate this problem. In addition, eating ginger or adding it to food is a healthy and safe way to take advantage of its anti-inflammatory properties, but ginger supplement should be used with caution, as it may interfere with some medications, or it may lead to several side effects. Benefits of ginger for the heart. Ginger can contribute to the prevention of cardiovascular diseases, as it may reduce blood pressure and cholesterol, and reduce heartburn, and may reduce the incidence of heart attacks and improve blood circulation, as a study published in the International Journal showed Journal of Cardiology in 2009, that ginger has an antioxidant and antiplatelet aggregation effect, in English, antiplatelet, but most of these studies have been limited to animal and laboratory experiments, so more studies are needed to confirm this effect in humans. It is worth noting that those with heart disease should be cautious when consuming ginger, as it is believed that it may make some of their conditions worse, and it is better to consult a doctor before using it. And to read more information about this, you can refer to the paragraph of ginger damage. The benefits of ginger for blood pressure. Ginger is one of the types of plants that may help lower blood pressure, as a preliminary study published in the Journal of Nutrition in 2017 indicated that daily consumption of ginger is linked to reducing the risk of high blood pressure, as a small study published in the Journal of Cardiovascular Pharmacology in 2005. It is possible for the extract of raw ginger to reduce arterial blood pressure in the group of mice that were subjected to the experiment, and this decrease was based on a dose of 0.3 to 3 mg per kilogram. In addition, a systematic review published in the journal Phytotherapy Research in 2019 indicated that ginger supplementation significantly reduced systolic and diastolic blood pressure, and on the other hand, ginger may help reduce water and sodium retention, which helps lower blood pressure, as it may be considered one of the natural diuretics. It is worth noting that caution is necessary when using ginger with antihypertensive drugs that work in the same way, and you should consult a doctor in this case, as this can lead to a severe drop in blood pressure. Ginger benefits for the kidneys. A laboratory study published in the Scientific World Journal in 2012 indicated that it is possible for the ginger extract to improve kidney function and reduce free radicals, and it may also help to inhibit the transmitters of infections and restore the satisfactory tissue structure of the kidneys to their normal state, thus improving the state of renal insufficiency caused by carbon tetrachloride. Ginger benefits for nerves and memory. Some animal studies indicate that ginger can help inhibit the inflammatory responses that occur in the brain, thanks to the presence of phytochemicals and antioxidants, and these infections, especially chronic ones, and with oxidative stress, can accelerate the aging process, as it is believed to be a factor in the occurrence of cognitive impairment associated with aging and Alzheimer's disease. In addition to that, a study published in the journal Evidence-Based Complementary and Alternative Medicine in 2012 showed that ginger extract can improve the capabilities of cognitive processes, otherwise attention, in addition to improving memory and the time required to cause a reaction time, in middle-aged women, without causing side effects for them. In another study published in the journal Annals of Anatomy in 2014, researchers pointed out that ginger contributed positively to affecting the brain in a group of diabetic mice, and the possibility of using it to reduce the damage that may be caused to the brain as a result of diabetes, as ginger helped to reduce levels of oxidative stress, inflammation, and reduced apoptosis. Ginger damage. The degree of safety of using ginger. Ginger intake in a moderate amount by mouth is often considered safe, but it may cause a number of mild side effects sometimes, such as diarrhea, heartburn, or a feeling of stomach discomfort. Warning: using ginger. There are some cases that you should be careful when using ginger, including the following. Diabetics. Ginger intake can reduce sugar levels in diabetics, and it may raise insulin levels, so it is advisable to consult a doctor before taking it. Hemorrhagic disorders. Ginger intake can sometimes increase your risk of bleeding. Heart diseases. High doses of ginger can worsen some conditions of heart disease. Children. It is advised not to give ginger to children younger than 2 years old as mentioned previously. Drug interactions. Ginger is one of the nutrients that may interfere with a number of important medications, such as blood thinners, or anticoagulants, such as fenprocumin, and warfarin. Since ginger slows the blood clotting process, so consuming it along with these medications can increase the risk of bleeding. In addition to that, ginger may reduce blood sugar, so consuming it in addition to medications used for diabetes can lead to a very low level of blood sugar levels. Does ginger help burn fat? There are no studies that indicate the role of ginger in promoting fat burning, but this kind of herbs is likely to be associated with weight loss, and at the same time, it can help reduce the risk of heart disease, and other side effects of weight gain, due to its antioxidant and anti-inflammatory properties. And a systematic review published in the journal Critical Reviews in Food Science and Nutrition in 2019 and included 14 different studies indicated that ginger and its nutritional supplements can significantly reduce several indicators, such as body weight and the ratio of the waist circumference to hip ratio, hip circumference, in people who are overweight or obese. While you cannot influence the body mass index, as a laboratory study published in the Journal of Science of Food and Agriculture indicated, that ginger supplement can reduce weight by contributing to controlling the level of blood sugar in mice that she was on a high-fat diet. It is also believed that ginger powder, in the event of consuming a small amount of it, can increase the feeling of fullness and reduce appetite, and in a preliminary study published in the journal Metabolism in 2012, it appeared that eating ginger contributed to reducing the feeling of hunger and enhancing the associated thermogenic process, thermogenesis, metabolism, which may contribute to weight control, but these results still need more evidence to confirm. Ginger products and their benefits. Ginger oil is extracted in a number of ways, but the best type of it is that which is extracted from the whole unshelled rhizome and is characterized by the presence of the compound gingerol, which is responsible for most of the benefits provided by ginger. Ginger vinegar. Green ginger can be used to make natural vinegar, but there are no scientific studies looking at the benefits of this type of vinegar. Ginger jam. Fresh ginger can be used to prepare and eat ginger jam in several ways, and other types of fruits can be added to sweeten its taste, as its savory taste may be unpalatable to some people, especially children. How to use ginger. Ginger can be used in many different ways in food and drink, as its rhizomes or horizontal legs, rhizomes, can be eaten as fresh or cooked vegetables, or used as a kind of spice and spices to flavor foods, or use fresh ones to make ginger tea, and the leaves can also be used in food, or used as part of traditional medicine. In addition to that, some people use ginger nutritional supplements, because of the potential health benefits. The sources.